Hi, my name is Jason. I'm gonna be your student nurse today.
Hi, my name's Matt. Nice to meet you.
Nice to meet you too. I'm gonna do some hand hygiene real quick. Matt, how you feeling today?
Doing good, doing
Yeah.
good. Yeah.
Okay. Before we get started, can you just go ahead and state your full name and date of birth?
Yep, my name is Matthew Stasek. Birthday is 8/23/85.
Okay. Thank you for that. And then what brings you in today?
Just here for a physical. I went to the doctor for the first time in like 11 years a few months ago and just figured I'd do a physical this time.
Okay. So today what we're gonna do, I'm just gonna go through a health history for
Okay.
you. I'm gonna take a quick set of vitals,
Okay.
and then we'll get into the physical assessment. How's that sound?
Yeah, that's fine with me.
Okay. So just to start off, do you have any allergies?
I'm allergic to one drug. It's called L-asparaginase.
Okay.
It's a chemo drug. Most people wouldn't get it, but yeah, it gave me like severe bruising and pancreatitis.
Okay. When did you last have a reaction to that?
The last time I had it was like 2001, 2000, somewhere around there.
Okay. And then, do you have any other allergies to any food or environment?
Nope.
Okay. And then, are you currently taking any prescribed medications?
Yes, I am taking Femara. That's the only drug I'm on right
Okay. What's the dosage and how
now.
often do
It's
you take it?
2.5 milligrams once a week.
Okay. And
I've
then
been
what
on
do
that for about 2 months.
okay. And then what are you taking it for?
I was diagnosed with hypogonadism
Okay.
as part of like having gone through chemotherapy and stuff as an adolescent. So that's to balance out my hormone levels.
Okay. And then, are you taking any over-the-counter medications?
Just over-the-counter omeprazole. Sometimes I get some reflux.
Okay. And then, are you taking any herbal supplements?
No.
Okay. And then, can you describe to me your current and past medical history?
Yeah. So I have the hypogonadism, occasional reflux. When I went to the doctor a few months ago, I was diagnosed with high cholesterol. It was like 270, I think. So not very good. I had cancer when I was a kid, non-Hodgkin's lymphoblastic lymphoma. I was diagnosed in 97. And then I got through that and did chemo. And then I got re-diagnosed with acute lymphoblastic leukemia in 2003. No, 2000. I finished chemo in 2003. I did chemo and radiation. Chemo sucked. I ended up with pancreatitis and pneumonia, and I had a priapism that I had to have surgically fixed. And as far as medical history, that's mostly it.
Okay. And then, can you describe to me any past mental health problems, if any?
No, haven't had any. I mean, while I was on chemo, I had a little bit of depression, but nothing since then.
Okay. And then, have you had any surgery before?
Yes. I had testicular biopsies in 2000 and 2002 and 2003. I had a lung biopsy in 2001 for the pneumonia that I had. And then I had a port put in 1997, another port put in 2000, and then that one was taken out in 2001, and I had a central line put in on that side.
Okay.
And I had a tonsillectomy. I don't remember what year, but I was like 24.
Okay. And then, any past or any family medical history I should know about? Yeah, mom or dad's side?
Yeah, so I have kidney failure on my dad's side through my uncles. High blood pressure on my dad's side. His parents both had high blood pressure. High cholesterol is also on my dad's side. Like all of my uncles and my dad and my grandparents on his side had that. I think that's it for that. Oh, and prostate cancer. 2 uncles had prostate cancer. My mom's side, anxiety and depression. One of my aunts was in an insane asylum for like 30 years, but I don't know why. I don't know what her diagnosis was. And that's mostly it. And arthritis on her side also.
Okay. And then, do you drink any alcohol?
Yeah, I usually drink socially. I mean, I don't go and see friends, but we play Dungeons and Dragons on like Fridays and Saturdays. So usually when I play.
Okay. How much do you usually drink?
2, 3, 4, depending on how long we're playing and how good of a time I'm having.
Okay. And then do you smoke any tobacco products or any e-cigarettes?
I vape occasionally, but I don't smoke
Okay.
tobacco.
And then are you in a relationship at all?
Yeah, I currently have a girlfriend. She lives in Leesburg, so I'm back and forth between my parents' house in Springfield and Leesburg, where she is, and Baltimore all the time. So.
Okay. And then do you work at all or you're still?
No, full-time student right now. I was working. I've worked in medicine and I worked in pet care and
Yeah.
worked in the grooming department for a while.
Okay. And then any issues with any activities of daily living?
No, I just wish the gyms were open.
Yeah.
Getting fat.
Yeah, me too. And then do you have any kids at all?
No, no kids.
Okay.
That's another thing that happened with cancer. I was diagnosed as sterile after radiation.
Sorry to hear that.
That's fine.
And then lastly, do you live with anyone else?
In my apartment here, no. But when I visit my girlfriend, I live with her. And I guess when I visit my parents, I live with them. So I'm
Okay.
always on the move.
Oh, gotcha. So next, I'm just going to ask you some more detailed questions about different body systems.
Okay.
Just bear with me. There's a lot of questions there.
Okay.
I understand that. So starting off with neuro, do you have any tingling or sensation in your feet at all?
No tingling in my feet or my hands or anything.
Okay. Any persistent headaches or tremors?
Nope.
Okay. And then any loss of balance or loss of strength at all?
No, only when I drink and I lose my balance.
Okay. And then any difficulty moving your neck or your head at all?
Nope.
Okay. Good. Any difficulty swallowing?
Mm-mm.
Okay. And then have you noticed any swollen or tender lymph nodes?
I do have one lymph node that my oncologist knows about. It hasn't changed size or anything like that in like 15 years or something like that, but it's there and I know it's there, so I just make sure I watch it.
Gotcha. And then any changing in hearing or any ringing in the ears?
No.
Okay. Any change in vision or blurred vision at all?
No.
Okay. Do you wear any glasses at all?
Nope.
Okay. And then do you have any redness in the eyes or any eye discharge?
Mm-mm.
Okay. And then so going to the cardiovascular system, any chest pain at all?
No chest pain.
Okay. Any shortness of breath?
No, only when I work out super hard, but
Okay.
that's normal. I think.
Yeah. Any have you noticed any swelling in your feet or ankles?
No.
No. Good. Okay. And then going to respiratory. So any difficulty breathing?
Mm-mm.
Okay. Any persistent cough?
Nope. Haven't been sick in a couple years.
Okay. And then any history of respiratory problems? I know you said you had pneumonia.
Yeah, just the pneumonia. I used to get sinus infections fairly often, but I've had like one since I got my tonsils taken out. So
Okay. Have you had any abdominal pain at all?
nope.
Okay. Any nausea or vomiting?
Nope. No nausea, vomiting.
Okay. Have you noticed any black or bloody stools?
Nope. Normal poops.
No, oops, that's good. Okay. And then for your kind of your muscles, notice any joint swelling or joint pain?
No. I do have occasional like flare-ups of like my wrist pain because
Okay.
I've had tendonitis before, but other than that, no.
Okay. Any muscle or back pain?
Nope.
Okay. And then have you noticed any decrease in the range of motion of any of your joints?
No, I mean I'm inflexible, but I don't think that's like a joint issue.
Yeah. Okay. And then have you noticed any burning sensation when you pee?
No.
Good. Okay. What about any blood in your urine?
Nope. Nothing like that.
And then have you experienced any unintentional loss of urine, accidental?
Mm-mm.
No? Good. Okay, cool. Everything looks good there. So what we're gonna do next is I'm gonna take a quick set of vitals. Okay. So I'm gonna start off by taking up blood pressure.
Okay.
All right, perfect. You wanna roll up that sleeve. So I'm gonna start off by getting a pulse obliteration pressure. There you go. How's that feel?
Yeah, it's fine.
So up there, if you just want to rest your arm like in your leg right
Okay.
here.
That works. Cool.
All right, so I'm gonna try to find brachial. I'm just gonna go for radial. 120 as your pulse obliteration pressure. I'm going to take a quick heart rate. Okay. So I have your heart rate as 80 beats per minute and your respiratory rate is 16. Okay. All right. So I'm just going to take another one more blood pressure. Okay. All good there. I'm going to pump it over 30 to 40 above your obliteration pressure.
What do we got?
So I have your blood pressure at 130 over 100. So it's a little high.
Oh, that's really high.
Nothing to worry about though. So your heart rate was within the normal range, which is 60 to 100. And then your respiratory rate is within the normal ranges as well, which is 12 to 20. Okay. So I guess got some silly questions to ask you real quick. What is your name?
Matthew Stacy.
Perfect. And then where are we today?
In your bedroom that's supposed to be a hospital.
Perfect. And then what day of the week is it?
Monday.
Awesome. And then why are you here today?
For physical.
For physical. Perfect. So patient is in O times 4 and conscious. So we're just going to start the physical exam now. Okay.
Okay.
So we're going to start with the neuro assessment. So I'm going to palpate the head for any lumps, masses, or tenderness. Anything there? Good. Okay, so I'm going to palpate the lymph nodes. So I have submental right here, submandibular, tonsillar, preauricular, postauricular, occipital, posterior cervical, anterior cervical. And then can you go ahead and shrug your shoulders? All right, and then we have supraclavicular. So those are non-tender. And I did feel this on this side. But you said that was normal, correct?
Yeah.
Okay. So what I'm gonna do, we're gonna do a confrontation test, so I'm gonna just have you stand up real quick.
Okay.
Just go ahead and cover the same eye as me.
Okay.
Perfect. And just let me know when you see my fingers, okay?
Okay. I can see. I can still see it.
Cool. And then
Yeah.
Cool. Yeah. Yeah. Cool. We're gonna switch eyes. Okay. Yeah. Yeah.
I can still see it.
Yeah. Cool.
Keep going.
Yeah. Almost done.
Yeah.
Cool.
Yeah.
Yeah. Cool. Awesome. Thank you for that. Everything's good there. If you want to take a seat again. So now I'm just gonna look at your eyes and just assess burl up, burl up. Awesome. And then can you go ahead and look at the tip of my stethoscope or my pen light? And then go ahead and look at the door handle. So look at my pen light, door handle, and back of my pen light. And then door handle. Perfect. So people are equal, round, reactive, and accommodating. So now I'm just gonna have you follow the tip of my pen light just with your eyes, okay?
Okay.
Perfect. All right. The extraocular movement is intact. So I'm gonna have you just go ahead and clench your jaw.
Okay.
My mastication's good. And then I'm just gonna have you remove your mask, just drop your mask real quick. Okay, so just give me a big ah. Perfect. So I'm gonna check the cheeks, the tongue, the uvula. So there are no tonsils, uvula is midline and rising with ah. Tongue is pink and granular, teeth are all present. There's no signs of any cyanosis. The lips are pink. Perfect. And then I'm gonna go ahead and have you use your smile real quick. Perfect frown. And then puff out your cheeks. And then just resist me pushing out. Perfect. All right. So I'm just gonna assess facial sensation. Just let me know when you feel this on your face. Okay. Or close your eyes. Perfect.
Now on my forehead. On my right arm.
Perfect. Then next, I'm gonna have you just stand up one more time. You just want to go face the windows.
Okay.
On this, I'm gonna whisper 3 words, and you just let me know what I said. Okay.
1, 2, 3.
Perfect.
Dinosaur plant dead.
Perfect. You go ahead and sit down. Just go ahead and shrug your shoulders real quick. Perfect. And resist me pushing you down. And then pull up on. Perfect. So next, I'm just gonna have you remove your shirt.
Okay.
Do you want a robe at all?
Oh no, I'm okay.
Okay,
Thank you.
Perfect. Yeah, of course. And then I'm just gonna have you just sit in this chair. If you just want to go ahead and face my computer.
Okay. Like leaning back in the chair and
I'm just gonna sit forward a little bit.
Okay.
Perfect. That's great. All right. So I'm just gonna inspect the posterior chest. Everything looks symmetrical. There's no lumps, masses, no bruising. So I'm gonna start off by assessing tactile firmness. So Matt, when you feel my hands on your chest or on the back, just go ahead and say 99.
Okay. 99. 99. 99.
Perfect. So no signs of any consolidation or any fluid in the lung spaces. So next I'm gonna assess percussion. So I'm gonna do 9 areas bilaterally.
Okay.
And I'm gonna do a zigzag formation. Okay, so everything sounds normal, and appropriate. Next I'm gonna do is I'm gonna assess CVA tenderness. So Matt, I'm just gonna do a nice thud on your back.
Okay.
Just let me know if you have any pain, okay?
Okay.
Anything? No?
Okay.
Nope, okay, okay. So next I'm just gonna auscultate the lung fields. So what I'm looking for is any wheezing, or any like crackles at all. So Matt, when you feel my stethoscope on your back, just take a deep, or just a normal breath in and out.
Okay.
If you feel any lightheadedness, just let me know, okay?
Okay.
I'm gonna do 9 areas bilaterally, using the diaphragm on my stethoscope. Perfect. All right, so lung sounds are clear. So I'm gonna move on to the anterior chest here. So what I'm gonna do is I'm gonna inspect the chest. I noticed there's 2 surgical scars, mid-clavicular, both left and right, about 2 to 3 centimeters.
Yeah, that's where I had my central line.
Okay. So I inspect the rest of the pericardial area. Everything looks appropriate. There's no bruising, pulsations. Everything looks good, symmetrical. AP transverse diameters 1 to 2. Everything looks normal. So what I'm going to do next is I'm going to assess the carotids. So what I'm going to do is I'm going to palpate it, and then I'm going to also do it.
Okay.
So we're right here, first side. And then I'm going to also do it using the and then just gonna hold your breath when I do it.
Okay.
Perfect. What I'm going to do next is I'm going to listen to lung sounds. So 3 areas, superiorly, bilaterally.
Okay.
And then after that, I'm just going to listen to some heart sounds too.
Okay.
And then I'll finish with palpating your chest. Okay. So I'm going to start off using my diaphragm. So once again, when you feel my stethoscope, just take a deep breath in and out. Okay. Perfect. Lung sounds are clear. I'm gonna now also take heart sounds, so starting second intercostal right sternum border for aorta. Second intercostal left sternum border for pulmonic. Fifth intercostal left sternal border for tricuspid. And then fifth intercostal midclavicular for mitral. Alright, so I positive S1 and S2 sounds. I'm gonna switch over to my bell and then just do it one more time. Cool. So negative for any murmurs or any groups with that. Now I'm going to palpate the PMI.
What's the PMI?
It's just where you can feel your heart on your chest. With
Okay.
Your heartbeat. Okay. Just right at the apex right here. The regular rate. Cool. Okay. What I'm gonna have you do next is lay on the bed.
Okay.
I'm just gonna do a quick abdominal assessment. You keep your feet up there. All right. So I'm gonna inspect the abdomen for any lumps, masses, any bruising at all. I think it's clear, symmetrical as well. So what I'm gonna do is, I have belly button work, I'm sorry. Very good. So what I'm gonna start off is by auscultating the 4 quadrants. All right, using the diaphragm. All right, so positive bowel sounds, and now I'm gonna auscultate the epigastric, the renals, and the iliac arteries. Okay. What is normal there? What I'm going to do next is I'm going to percuss your abdominal area.
Okay.
Normal there. Lastly, what I'm going to do is I'm going to palpate your abdominal quadrants. Just let me know if you have any pain or tenderness. Okay.
Okay.
Anything there?
No.
Okay. Perfect. You can go ahead and sit up for me.
Okay.
All right. Before I get, I'm just going to assess your trachea real quick.
Okay.
All right. I'm going to skip that. So trachea is midline, no tracheal deviation. Go ahead and swallow for me. All right. And then I cannot feel your gland back there. Thyroid, yeah, that's right. I can't feel that, so that's normal. If you want, you can put your shirt back on. And we're just gonna do the rest of this. Promise we're almost done here. Okay?
No, it's okay.
All right. So I'm gonna have you copy some just silly arm movements
Okay.
of mine. So just go ahead and find it back. Cool. And then back down here. Awesome. And then go ahead and flex the biceps. Extend. All right. Move your wrist up. Down. All right. So patient has full range of motion. So I'm gonna assess muscle strength now. So go ahead and put your arms out. Just go ahead and push down. Pull up. Okay. Go ahead and flex in. Push out, and then your wrist. Push out, push in. Perfect. So we got full muscle strength. Plus 5. Okay. And then next, I'm going to assess radial pulses. Awesome. So I have radio pulses are equal bilaterally, regular rate and rhythm. Assess capillary refill. So go ahead, flip your hand over. Let's see. Let's go. Perfect. And all right. So capillary refill is less than 3 seconds, which is normal. What I'm going to do next is I'm going to have you close your eyes and stick your fingers out for me, and just let me know if I'm pulling your finger up or down. Okay.
Middle finger up. Middle finger down. Middle finger down. Middle finger up. Middle finger down.
Perfect. And then what I'm going to do next is I'm going to assess your reflexes. Okay. So just relax your arm as much as you can. And just relaxing your arm right there. Just let me know if you need pain. Okay. That's good.
I'm sorry, they always have trouble with
Yeah,
that one.
it's okay. Let's try your tricep. Okay. Relax your arm as much as you can. So for free. Nice. There you go. Okay. Let's try the other arm. Let's do bicep again. Yeah, this one's a little tricky. Let's go over to your tricep. Once again, just relax your arm as much as you can. Ooh, nice. There you go. Yeah. Cool. So reflexes are intact. So now I'm going to go on to the lower extremities. I'm going to inspect the legs so that equal hair distribution around. Assess temperature is warm, dry, intact. I'm going to do another set of reflexes. Okay. So I'm going to assess your patella right here. Your feet are dangling. Perfect. Nice. Ooh, that's a good one.
Yeah.
Okay. And then I'm going to assess your Achilles reflexes. You want to go ahead and remove your socks real quick? Perfect. All right, good. I'm going to assess your muscles. So go ahead and push your knees out, push your knees in, kick your knees out. Perfect. Pull back, and then pull up on your toes and push down. Your feet. Perfect. Full range of motion. Muscle strength is normal. What I'm going to do next is assess any peripheral edema. So 2 spots each leg.
What's edema?
It's just swelling of accumulation of fluid in your legs.
Okay. Yeah, I don't think I have that.
Yeah, you're all good there. What I'm going to do next is I'm going to assess your dorsal patellis pulses.
Okay.
Sure, on top of your feet here. Nice. So it's equal bilaterally, regular rate and rhythm. And I'm going to assess your posterior tibialis right here. Equal bilaterally, regular rate and rhythm. Perfect. And then lastly, what I'm going to have you do is I'm going to assess your walking and your gait. You just want to walk to the door and back.
Okay.
And then on the way back, I'm just going to have you do heel toe. So heel toe. Perfect. Perfect. You can go ahead and sit down, put yourself back on.
What's left?
All right, and then one last thing I'm gonna have you do is I'm gonna have you do some. I forgot this. Some rapid alternating movements. So what I'm gonna have you do is just copy me. Okay. So just go through. Go ahead, speed up. Perfect. That's all good. I think that's everything. I'm gonna go ahead and get the physician. I think you're all set.
Okay.
Awesome. Thank you so much.
Anything else I need to do?
I think you're all good.
Okay.
Yeah.
Awesome.
Thank you.